Hospitals and health systems are rightly called cornerstones of their communities. And as nearly 6 million patients spread across 6 states can attest, few care providers take that mission more seriously than Advocate Health. Headquartered in Charlotte, North Carolina, Advocate is the third largest nonprofit health system in the nation and takes pride in serving a large number of under-resourced patients. Name a want, or a need, or a gap in community services, and chances are Advocate Health is already working with local partners to address it. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. According to Dr. Kinneil Coltman, Chief Community and Social Impact Officer, Advocate Health provided nearly $6 billion in community benefits in 2022. The fund supported a wide variety of programs and initiatives as leaders spent a lot of time thinking about where do we focus. In this podcast hosted by Aaron Wesolowski, Vice President of Policy Research, Analytics, and Strategy with AHA, Coltman says certain priorities leapt to the top. They included addressing food insecurity, affordable housing, and meaningful employment.
Dr. Coltman, thanks so much for joining us. We're so excited to be talking to you today. Can you start by telling us a little bit about Advocate Health and the patients and communities that you serve?
Sure thing. So, Advocate Health is the third largest nonprofit health system in the nation. We serve a diverse array of patients, nearly 6 million unique patients across 6 states: Alabama, Georgia, Illinois, North Carolina, South Carolina, and Wisconsin. Many of our hospitals serve as the primary safety nets in their communities. So, we serve a large number of under-resourced patients. We're the number one Medicaid provider, for example, in Illinois and North Carolina by volume. But throughout our footprint, we also care for patients in about 68 rural counties, and that's about 3 million residents. So we're really proud of, the work that we do around solving for underserved communities' needs.
Great. How does Advocate think about community benefit across the system and across all those hospitals?
When I think about community benefit, I think about what are we doing that is truly benefiting society. We've noticed that sometimes those conversations may focus on one aspect of our community benefit, but we really look at it holistically. The pandemic really shined a light on the absolute necessity for us to focus on working even further upstream than maybe we would have in the past, to really focus on disrupting those root causes of health inequities in our communities. For us, we spent a lot of time thinking about where do we focus so that we're going to have the deepest and most meaningful impact. And for us, we've kind of drawn a line in the sand around food insecurity, affordable housing, and employment. When I say that, I mean meaningful employment, good wages, the provision of health insurance, career and economic mobility. So that's where we focus our energies, both in terms of the programs we develop internally, but also in how we invest in the community. But all in 2022, we had nearly $6 billion in community benefit, and that includes, free care for low-income patients, but also the cost of educating the next generation of healthcare workers and research. We have a huge research enterprise that extends across our footprint, but also investing in those safety net organizations that we know are, really serving those that need it most in our community. We've invested in things like a medical clinic in an HBCU in Charlotte, or really novel solutions like virtual care in community centers. And we have countless food pharmacies across our footprint. So it manifests in a variety of ways, but all in service to disrupting those root causes of health inequities.
That's really impressive and really exciting to hear, and I want to hear more about it. Before we go deeper into Advocate Health and all the good that you all are doing, I'm curious to hear a little bit more about you and your career. How did you get into healthcare, and how did you find yourself in the role that you're in now?
Yeah, so I actually grew up in a rural area myself. I grew up in the mountains of Western North Carolina. I had some really profound experiences in high school and in undergrad that led me down this path of wanting to work on kind of institutionalized systems of inequality. And so that's what I've devoted my career to, is really helping to architect health equity strategies in large, complex health systems. And for me, it's very personal. I still have a lot of family members that live in very rural areas that have a lot of challenges around transportation and other social drivers of health. So I think a lot about the folks that I grew up with when I think about the energies that I bring to my work every day.
Great. Well, thank you for sharing that. What trends have your hospital seen in recent years in terms of patient and community needs, and how has that changed advocates' focus on providing care beyond the four walls of the hospital?
I think it all boils down to meeting people where they are and getting to them before they need us, right? That's the goal. And so a lot of our conversations within our leadership are around modernizing access. We know that access to care is a dramatic issue, that it impacts health across the country. So we've tried to think about really creative ways to reduce that friction to access care and to make it, easier for folks no matter where they live to be able to access care. So thinking about things like our virtual strategy, that is one of, if there are gifts around COVID, that has absolutely been one. It's helped us to kind of broaden our aperture around thinking about where and how we can use virtual care in the future. So we, for example, have made huge investments and had other investments from partners in school-based primary care and behavioral health in schools. We are in 213 schools, and that number grows every time I share that, in 11 counties. And had just in the last year 26,000 patient visits through those, and we've been able to show that we can have a 32% reduction in visits once we create those kinds of interventions. But we've also embedded virtual clinics in low income affordable housing communities, in immigrant service centers. We're thinking about all kinds of places where we can deploy these interventions in new and different ways. We also see a lot of promise around the management of chronic disease. We've stood up virtual chronic care management programs for patients that have, those tough chronic diseases to manage, like diabetes, for example. So enrolling patients in those programs, knowing that they don't have to access transportation and deal with some of the other friction of accessing care, that they can access that support virtually, is a big deal. And then the last one that I'll mention is our signature hospital at home program, which we stood up virtually overnight during COVID. But since then, we've been able to care for hundreds of, patients at a time from the comfort of their home. And if you think about it, no matter how good of a job we think we do around care in our hospitals, people would always rather be in their homes than in a hospital. And so we've been able to deliver hospital level care inside the comfort of someone's home. So we're still working on those solutions, but we are giving it all we've got because we know that our patients and communities are depending on us to kind of move past those traditional access points that we've relied on historically in healthcare.
That's great. And I imagine that a lot of those local partnerships help you anticipate new needs that might be coming down the road at you as well.
Yeah, absolutely. So we've spent, for example, we obviously have a large footprint in Chicago, and Chicago has had, a surge in immigrants in recent months. And so trying to figure out how can we be part of the solution of, delivering care in unique and different ways. But we're seeing that, opportunity across our footprint to listen more deeply to our communities and say, where do you want to get care? How do you want to get care? When do you want to get care? And then we have a wonderful strategy team that's guiding us to think about innovative solutions in terms of how we deliver that care differently than we have in the past.
Stepping back, can you tell us why Advocate is committed to providing these services that clearly extend beyond traditional medical care? Why is it important to impact health and well-being before someone even becomes a patient in a facility?
I think the answer to that question is, a 5-minute conversation with any emergency medicine provider that I've ever worked with. And I'm sure you have as well heard these stories, but you think about in our emergency rooms, you may have someone who's unhoused and they may come 2 and 3 times a week sometimes. But as soon as that person secures housing, then we see their use of emergency rooms change for the better, right? And so you have all those stories that our providers collect and tell us about. And I think that creates a sense of urgency for us to be able to work further upstream, try to prevent that unhoused situation in the first place, try to get at those root causes that led to that incident of homelessness. So those are the things that we're thinking about all the time, that we've got to constantly work upstream because, we have level one trauma center hospitals and, so many communities that are in need. We are the safety net when all of the other safety nets break down. We're at the very end of the line. So we see when all the other social systems fail, we're there to catch patients and community members when they need us. So that creates a burning platform, I think, to work upstream and be part of the solution.
Building on that topic of access, ensuring that all community members have access to care also means working to make care more affordable and make sure that patients have options around financial assistance. Can you talk about your work to improve financial assistance and the process around accessing it? And why is it important for families and patients?
Oh, yeah. So, I mean, we talk about that all the time. In fact, when Atrium Health and Advocate Aurora Health came together just over a year ago, that was one of our big commitments was around affordability. And we already in both legacy systems had a lot of strengths, but we tried to, curate the best of what each legacy system had in terms of building what I would argue is one of the most comprehensive and patient-centered financial assistance programs in the country because you hear a lot of discussions about federal poverty levels, and then, of course we've committed to a very generous level of 300% federal poverty level gets full financial assistance, full charity care, and then up to 400% very, very deep discounted care. The devil's in the details on some of this stuff, that it's how we administer our program that I think is really meaningful for patients. So when you think about our patients who are under resourced and what may be going on in their lives, maybe working 2 and 3 jobs, we've really thought critically about how can we reduce the friction involved in qualifying for our financial assistance programs. And so we have invested in a pre-qualification service that's really effortless, seamless to our patients. So I'm really proud of the way that we're working to reduce friction for patients and being able to access our policies. We also provide financial assistance for care that we know patients need. So it's not just for emergency care, but it's also for other, essential care, primary care, behavioral health care. So those are the things that we focused on. There's a lot of other players in the industry, providers, insurers, drug makers, pharmacy benefit managers. I can go on, that together we need to solve for the affordability challenges in healthcare. We're committed to being, part of that coalition that solves for this together.
Absolutely. That's great to hear. Last, what are you most hopeful about in healthcare? And are there things that you're really excited about in terms of innovations or patient programs that Advocate Health has planned?
There's so many big challenges ahead of us as an American healthcare system, right? But I'm also encouraged about what we can accomplish when we really focus. I mean, COVID taught us how much we can accomplish if we really focus on something. So, for our part, over the last year, we've been standing up the Advocate National Center for Health Equity, and that's a really bold and ambitious strategy because it involves a national operating model that then will manifest interventions in all of our major service areas in different ways based on what the community tells us it needs, but also based on what we know from a public health data standpoint is also necessary to improve health. And so we are working on a very robust health equity analytics platform that will help us think differently just about how we bring data to providers to intervene, but making sure that we have good, clean data across our 6 million patients. But then also developing a framework of health equity interventions in our clinical environment, soup to nuts. Every service line is in. We have board approved health equity goals that we're cascading throughout the enterprise. but we're also looking at architecting national partnerships around those social drivers of health. But with all of our interventions, we have committed to studying them academically, right? In an academically rigorous way so that we can develop proof points, that we can educate other health systems that want to do this work, but also policymakers, elected officials on, what are the solutions of the future around health equity? Because we've got to have partnerships and a coalition to solve for these entrenched inequities together. So I'm excited about that. We're still in building mode, but I'm encouraged that we have a very ambitious board behind us that's very motivated around our health equity goals and ambitions.
Great. Well, thank you for sharing that. It's really heartening to hear all that you all are doing, and the scale of the benefits that you're offering the communities you serve in. So, thank you for sharing it. Thank you for being with us today.
Yeah, my pleasure. Thanks very much.